Health Practitioner Regulation National Law Application Bill 2023. And I believe that on the question that the bill be read a second time, it's the continuation of remarks by the Honourable Dr. Brian Walker.
Thank you, Acting President. Now, it has been some weeks since I began the speech, and it might serve us for a little bit of a repeat of what's been gone before, so that you can understand the context in which I am proposing my speech. Because, you see, looked at superficially, this is an excellent bill. It's a good bill. We're looking here at bringing into unity the way we manage or we give power to AHPRA, the body which supervises all healthcare practitioners from a variety of services. It's a vital service. And in that sense, it is actually a good bill on that basis. But the point I was making for this is that I shall be voting against this bill on a matter of principle. And you might well ask, what is that matter of principle? And I would be suggesting that the matter of principle is that we need to have a closer regard to the fact that this very important organisation has no supervision at any level of a parliamentary committee. Now, you might think, well, look, they don't need any because they're doing a good job. They've got experts there and it's all right and proper. So I went through some of the facts regarding what actually happens in the medical profession, because while you might have read all the books and listened to the lectures from people who are in the system, you're actually not getting the full picture. And in fact, very much you're getting only a part of the picture. The systems we have here are actually very conservative. And they're conservative because we have status quo thinking, because that's the way it's been, that's what's safe. What we've done before, we've proved that's safe enough, therefore we're not going to change. And it can take quite a deal of effort for a change to happen in the medical fraternity, because the problem is if we do it differently and is not as good, then people suffer or indeed die. I brought out the examples of Barry Marshall, who was pilloried for his unorthodox views, and that it was only by the grace of being given a Nobel Prize that the threat of disbarment from the medical profession was averted. We can take that further. Throughout history, we've had the same example again and again, and indeed again. Now, the whole point about having AHPRA there is a very valid and very important point. It's to protect the population, protect the people. One thing it does not do is protect the healthcare practitioners, specifically not. So the public here are the ones who are to be protected from bad actors, from those who are doing a disservice to the population, by doing the wrong thing, by doing things which cause damage, or indeed by not doing things and thereby causing damage. And that's very right. But note, there are two aspects to this. Two aspects of the active: I can do something that causes harm, or by not doing something, I also can cause harm. Now, I'll come to that in a short while. So we can look here at the examples of the horrors we saw from that eminent Dr. Patel over in Queensland, who was he wasn't a surgeon, he was more of a butcher, and he actually caused a great deal of pain, chronic pain and unalleviated pain. And we notice how long did it take for that particular butcher to be taken away, to the public be protected. And we saw how difficult it was for the staff then to actually report the misdeeds of that so-called surgeon, and how many people suffered as a result because his behaviour carried on unchecked. And this was thought to be suitable because, well, why? Why would it be thought unsuitable? This is part of the issue I want to be talking about. But the opposite can happen, and I mentioned also Dr. Teo and Dr. Fetke, doctors who have done their very best to help those, in Dr. Teo's case, those who could not be helped anywhere else, and still have found lack of favour with the medical bodies because of complaints against them, because that person actually died and they thought their person could be saved. So the thoughts were the operation's been done and the patient has died, therefore the surgeon had failed. When in fact, he wasn't operating on pretty much the hopeless cases, the ones that no other surgeon would touch. And of those who survived, they're very happy, but now he has been told not to continue working. Dr. Fetke, the example I gave there, was a cardiologist, still is, who was almost disbarred from the medical profession because he advised his patients to actually eat better, to stop eating the fast foods. That way he could reduce the risk of cardiac disease. A very basic premise, but it caused some trouble with the Dietitian Society, who then, through the back door, managed to get AHPRA to hound him. And it was only with a very public hearing where the AHPRA actually did never apologise for trying to get this eminent doctor removed from service for doing his job properly and well and giving patients good advice. No, they wanted to remove him because, you see, another organisation found that their ground was being impinged on. And that is wrong. That is plainly wrong. And I think all members here would agree with that. That is just not tolerable. So what I'm basically saying here is that it is possible, and I ask you to bear in mind the possibility that there could very well be vested interests at play here. When a point of view can be brought by a group very much with a vested interest in keeping their patients, and then action taken against the doctor doing the right thing, but being removed or almost removed. So this leads to the point here that when a healthcare practitioner is given a notification, which is a fancy way of saying that they've been accused of something, when they've received the notification, the consequence of that is, and I must say this very, very clearly and make it that you understand what is happening, is that that healthcare practitioner is deemed to be guilty until proved innocent. Guilty until proved innocent. The burden is now on that healthcare practitioner to prove innocence, not the other way around. And that, I think, is a major concern. I'll come to that in a short while later. But you can imagine, and I can only speak here on behalf of doctors because I have no particular personal knowledge of the other realms, but from the point of view of doctors, that it does mean there's an immense effect on doctors. In fact, the medical profession has been cowed into silence. Now, I ask you to consider this for a moment. Your healthcare professional is not able to speak freely for fear of being persecuted by the body which is charged with the duty of keeping the public safe. Consider that for a moment. Ask yourselves, is this a system which will give the best outcomes? I'm not going to ask you to come to a decision. I would ask you to consider the potential for a system to be dysfunctional. Because when you have doctors who are being cowed into silence, they are not then able to do that most important thing as a healthcare practitioner, that is, ask the questions which need to be asked to move a patient forward in wellness. This is the very reason why Dr. Barry Marshall was given such a hard time, because he thought new thoughts which were not accepted by the medical board. I can give you a current example. Now, you will, I think, be aware of the concept of attention deficit hyperactivity disorder, ADHD. But did you know that the current approach with AHPRA is not to accept that diagnosis as valid? In fact, the psychiatrists that they have employed to hold court over other psychiatrists is that ADHD does not exist. So from the position then of having to prove your innocence, you're coming across a colleague who is judging you, who has the presupposition that the diagnosis that you made is fundamentally flawed. And that's a very uphill battle to defend yourself against that, especially when you go into the hearing and you have no legal support on your side, but on AHPRA's side, they very well have legal support. It's very frightening. And you're very much at risk of losing your licence. And when you lose your licence, you lose your income. You're at risk of bankruptcy. You're at risk of losing your family. It's a very, very major assault on the freedoms of the health profession to think freely. And it may be one reason why the evidence-based medicine that we need in our society is not actually that evidence-based. Some people have said that perhaps only 70% of medical care is actually evidence-based, which means there's a fair chunk of what happens to you in your clinics right now, in your surgery, which is not evidence-based. And that is the result of a behaviour with the controlling body restricting freedom of thought, then it actually has an impact on our own wellness, does it not? And as a result of that, we are then stuck in the status quo thinking, which means we're stuck in the past. Now, I would remind you that in the 1920s, it was the case that for asthma, the diagnosis of asthma, the treatment at that time was, and believe this or believe it not, but it is true, the treatment at that time was to give the patient a prescription for tobacco cigarettes which are laced with a bit of strychnine. Now, there's good pharmacological reasons why a little bit of strychnine would help reduce the secretions in someone who's got asthma. But I would put it to you that doing that today would actually be a grave mistake. It took a while for that to actually change. It took a while for the doctors to mend their ways as they thought about getting a new approach to managing asthma. We're stuck in the past. We're stuck often in the past with no scientific basis for that. Take, for example, and here I'm just going to use cannabis as an example because even now people are claiming that cannabis is a narcotic, which from a pharmacological point of view is a complete and utter lie. And yet, the medical profession does not shy away from that in large numbers of putting forward this lie as medical truth. So when we think about doctors being at the forefront of science, let us think again. The systems that we have judging us, holding court over us, are in fact stifling individual freedom of thought. And this, I would put it to you again, is not what we as a people need when it comes to our wellness, because wellness is an ever-changing field which must have excellent results, excellent science, excellent facts to allow us to take steps forward. I think only of the issue about recent case of glioblastoma in the brain. This doctor here was working in another field, was able to use that knowledge to work with his colleague to develop at a sudden pace the treatment which seems very likely to have mastered this particular glioblastoma, this malignant brain cancer. Now, it's early days. I don't know if it's going to work, but the thinking which went into that was wonderful. He had to carry it out on himself. He couldn't do it on a patient. Well, A, he was the patient, but that would not be permissible to put onto another patient because, you see, it hasn't passed the ethics committee. So people are probably dying right now who might benefit from that, but we're still waiting for the bureaucracy to catch up with the idea of helping someone think differently. So I mentioned vested interests, going back to that. We now have here a pattern of bias. There's no malintent I'm meaning here in my speech today, my second reading speech. There's no malintent. We're simply putting out what actually is happening and that the general public, and indeed members of Parliament, are not aware of, because it's not part of your daily life. It is a part of mine. And that pattern of bias actually means that the people who are orchestrating that pattern of bias are not subject to any oversight. They're not accountable to any of our elected members. At no level, at state or at federal level, there is no accountability for the actions which have been taken. And this results then, of course, in poor quality of control, of care. Because the effect on society coming down there, the doctors who are being blocked, slowed, held back, threatened, are not going to actually be able to control in any better way how we can deal with the major problems which are affecting our population today. I mention only for a start the mental health conditions we're facing. In 50 years, the psychiatric approach to managing major psychiatric illness has not improved. We've still got the same problems. And the medications which we now give, and I can speak personally, having given these medications many times, resulted in things like metabolic syndrome, diabetes, hypertension, and, of course, cardiovascular disease, followed, of course, by early death. But they weren't quite as mad as they were before. Are we happy with that outcome? So this poor quality of care means that things are not done which could be done, or it might result in us pulling back. I mentioned earlier the ADHD issue. Now, the thing about this is that if psychiatrists are not encouraged to make this diagnosis, and if at the same time the demand of mental health services on psychiatrists is such that there's a large waiting list, and if you're not then going to be accepting patients, A, because there's too many patients, and B, because you're not encouraged to make this diagnosis or indeed given trouble for making this diagnosis, How quickly will you be able to get your 6-year-old child seen by a psychiatrist to get the diagnosis of ADHD made, such that that child can then get an education assistance to help them through their school years? About 2 years. 2 years. And even then, they may not get the treatment they need. So now we're seeing a child who's being held back by 2 years because they're unable to get an education assistant, which then leads them down the path of being perpetually unable to catch up, and then not be able to lead a life to the fullest extent. So in fact, we're encouraging here the failure of helping the most vulnerable in our society. You might ask, why then are we not able to prescribe as general practitioners the medication which might be useful to treat a child with ADHD? Why not? Do you know the answer? I found out just recently it's because, you see, they're frightened that doctors are going to be prescribing amphetamines, which is one of the treatments for ADHD, because it might be sold on the street to drug addicts. So rather than saying, doctor, you've got 110% over the average of prescribing dexamphetamine, we'll have to examine your patients. No, they didn't do that. They didn't do looking out at the outliers, the statistical outliers. They did not choose to do that. They chose to ban all GPs from prescribing this medication, thereby preventing the children from getting their treatment, thereby exacerbating the problems we've got. It's a logical consequence of following that pattern of thinking that we're going to take control of this. I'll give you another example, actually. Many years ago in Germany, I had a patient come to me, and he was on his way out. He was dying. I had a new practice, almost no patients, and therefore I was looking for patients to come and, increase my number. He was in his late 60s, his 4th heart attack. He was in congestive cardiac failure. He came in with a blue nose, puffing as his chest was filling up with fluid, barely able to catch his breath, blood pressure 90 over 60. I remember this very, very, very well. And he said, "Doctor, help me." I said, "What medication are you on?" He was on every single drug that mankind knew at that time. At that time, I was aware of a new drug which had come out, captopril, which is actually a very interesting medication based on the Brazilian pit viper venom, and it was brought into service to lower blood pressure. Now, this man had low blood pressure, but the German pharma companies, they sent out people who were scientifically trained. And Germany is a very scientific country. And so I knew the biochemistry of how captopril worked at a kidney level. If you want to know, it's the angiotensin 1, angiotensin 2 conversion, and then the question here of sodium and potassium levels and water retention in the body. So I thought about that, thought a bit more, and realized if I was to give you a very small dose and add some salt into your soup, we'll see how that goes. Well, he did die 9 years later. Since then, we now see that these ACE inhibitors, as they're called, ACE inhibitors, are now one of the primary treatments for congestive cardiac failure. But at that time, at that very same time, in Australia, GPs were forbidden from prescribing ACE inhibitors. Forbidden. You could only get that with a cardiologist. You don't trust your doctors, do you? Allegedly. You've been scientifically trained, but we're not going to trust you. We're not going to trust you to prescribe a dexamphetamine. So this lack of trust in doctors is really quite disturbing, is it not? You're either scientifically trained or you're not. I recall also very well in Meriden, not too far ago in the past, when they said, oh, children under 2 with fever, there could be a problem with that. So now, every child under 2 with a fever presenting to Meriden Hospital will be RFDS'd out to Perth. What they were basically saying was, we don't trust you doctors to be clinically competent, and they were going to send these children out to a specialist in Perth, overwhelming the RFDS, who might be travelling off elsewhere to a snake bite. What do you choose? A snake bite victim or a child who may be dying of sepsis? Because one of them is going to die. So you can see my passion here is actually for wellness and for actually doctors being trained to be doctors and working professionally and competently and scientifically trained. But we're under an organisation which fundamentally doesn't trust us, and then puts in place barriers to keep the people safe, which at the same time are causing people to suffer. We can look, for example, at pain medication, and we know very well that opiates are absolutely contraindicated for long-term pain. But up until very recently, opiates were the only thing we could give effectively for managing pain because they weren't going to allow cannabis. And even now, the pain specialists are denying that cannabis actually works for pain. And they're allowed to continue that nonsense because they are supported by AHPRA. So, patients are suffering. 800 to 1,200 a year are dying of opiates in Australia. A lot of them medically originated. They've been giving opiates, and as a result, serious adverse effects have happened. And we think that's good. Let's give another one, which is perhaps a bit more close to the knuckle. Endometriosis, a very nasty diagnosis. People are reluctant to make that. The average time from presenting with a symptom to getting adequate treatment is 10 years. 10 years. And we're allowing here a low level of medical courage to make a diagnosis, to try this, to see what we can do to fix things right now. But no, 10 years. A patient I saw just the other week there, 15 years she has waited with intolerable pain. We have a system here which is not working optimally. And we have a system here with doctors who are unable, because of the control exerted from above, to think freely, as a result of which we have loss of freedom. The last experience I've got from this is COVID-19, when we had quite serious concerns about the efficacy of the vaccination. Now, I'm not going to deny that the vaccine had certain effects, beneficial effects. We can see reduction in deaths. We can see reduction of morbidity. But there are quite significant concerns for possible adverse effects, like, for example, myocarditis. Cardiologist I was speaking to admitted, but asked me not to spread this, so I'm not going to say his name, 300% increase in patients with myocarditis following COVID vaccines being introduced. Myocarditis. Now, one of the side effects of myocarditis is that you don't really know you've got that sometimes. Half of them are asymptomatic, but there is a damage to the lining of the muscles of the heart itself, which may result then in sudden cardiac death. And then the question comes when a sportsman dies in the field, oh, it's nothing at all to do with the vaccination. How do we know? Because we're not allowed to mention that. I'll tell you why we aren't allowed to mention it. So some while back, I asked, how is it we are allowing doctors to be forbidden from asking questions? The very foundation of the scientific endeavour is the ability to ask a question. But AHPRA now demands that we do what AHPRA says, although they are not a repository of science. The people who are actually on AHPRA are not all medically trained. And of those who are medically trained, one could doubt their qualifications because of some decisions they have made. But the question needs to be put. I have a colleague of mine. A patient asked, is the vaccine safe? And the reply came back, well, it's generally safe, yes, but there's a paper here which suggests there may be a problem, a peer-reviewed paper in a reputable scientific journal. And the response from AHPRA for showing a patient a reputable, peer-reviewed scientific article was to have that doctor removed from practice. Listen to this. For the ability to ask questions and freely do your research as a scientifically trained doctor, the punishment is to lose your privileges as the doctor. You could then wonder what's actually going on. The questions here that the TGA being 96% farmer-owned might have nothing to do with it. The fact that the AHPRA has biased and it has vested interests may have nothing to do with it. I don't know. The colleagues of mine who are having problems are really in deep, deep distress because they are being oppressed by a system which has little regard for free thinking, for science, and for serving the population. Their main concern is to keep our backside safe from being insured and to manage the system so that no one is going to jump up and start causing problems. We'll oppress them all equally, we're in charge, and you are going to know it. That's the impression I get. with my contacts with AHPRA has been entirely unsatisfactory. There's one time when I was challenged by AHPRA to justify why I stopped a beta blocker in a patient. Well, the reason was, of course, because the patient was asthmatic, and giving a beta blocker may result in sudden death due to bronchial spasm. 2 years it took for AHPRA to stop calling me guilty until proved innocent. This is normal. This is what the medical profession is facing, and by extension, all of the healthcare profession. Now, let it not be said that I'm criticising everything AHPRA does. Not at all. They perform a wonderful function, and they are deeply important to the safety of the population. They are. But we are about to pass legislation which will give AHPRA, over all of the states in this country, a power. And that power has no parliamentary supervision. Nowhere are they to be held accountable. You could then say, well, they give a report every year. Yes, they do. When was the last time we saw a parliamentary committee examining that? You might then say, well, the health ministers, of course, are managing this, and they're informed. Really? Informed by whom? Let me tell you a story. I was in the Soviet Union. You may know I speak Russian. And I was translating for some friends of mine who were in the gynecological hospital, and some Canadian doctors had come to visit. And I was sitting there in the middle, translating English into Russian and back. And I knew what I was saying or translating was wrong. Because I knew the situation. Look, there was a concrete prefab hospital there. There were live electric wires coming down the stairs. You had to bribe the nurse to get your bed changed from the previous patient. You had to put a bucket out the window to get food hauled up, so proper food. Patients were asking me, who can I bribe to get the best surgeon? This is what we're dealing with. But the Canadians left that meeting with my help as a translator, thinking that the Soviet system and the Canadian systems were probably equivalent. Because they weren't exposed to the truth. They weren't told the see, my Soviet colleagues there didn't dare tell the truth because they would have ended up in very unfortunate situations. That is what we had in the system of the Soviet culture. Now, let's take a look out at the wheat belt where wax holds sway. And one of the ministers, or just an MP, will come out there and ask some questions with permission. I, by the way, was forbidden permission to visit my old hospital and see how they're getting on. When you are there visiting the hospital, you will have a senior member of WACS attending with you who answers the questions. The health service manager will be there as well, who is primed just to do what she's told. The nurses and the doctors are actually forbidden from speaking. You're specifically told you will not speak. I came across this in the Soviet Union. It's exactly the same system. Do not let them know the truth. So you're given this kind of information there which approximates the truth but is not the truth, which explains probably why in the hospital where I was working 100% of the nurses wished to resign because they were deeply dissatisfied but could not because they had no job to go to and there's a drought and their farms weren't making money. But the people who came to visit had no idea about that. And these same people then go to Canberra to talk among themselves, not knowing the truth. You ask how I know this? Well, I've been there. So the ministers who are actually charged with making sure that the medical profession or the healthcare practitioners are actually meeting their obligations and discussing with AHPRA are not the people who have been completely informed. You might then say, well, how about the Chief Health Officer? Well, this is the same person who gave the advice to the Parliament here about the transmission of COVID can be stopped with the vaccine and that the deaths can be stopped with the vaccine. And he told actually a blatant lie. Well, he wasn't lying. He was simply passing on the information he had got from the pharma companies who had hidden that information. And then when I asked in this very place here for what exactly had he told the government, the response I got was, I can't tell you, that was cabinet in confidence. So the actual information we've got here is compartmentalised. And we're unable, at parliamentary level, we're unable at a senior medical level, we're unable at a junior medical level to actually know what's going on because we're not being held from the truth. This is a problem. And because of this, we've now got an industry which has made this state the meth capital of Australia, because they've decided it's far better to test a non-psychoactive substance in the blood, equate that to being high, and then removing them from their jobs. OK, let's go and get some methamphetamine. And now, as a consequence of us following that particular pathway, we have now caused untold damage, first of all, to helping the criminals develop their drug systems, causing damage in our society with people who are abysmally managing themselves with methamphetamine in our cities and in our small towns, with violence, with behaviour which is simply not supporting a healthy community. And this has happened because we have followed what is supposed to be good medical advice, but in fact is not, but meets the standards of a body which should be helping us to have high standards. And they patently fail at that. So, this is a problem which demands parliamentary oversight. This demands, if the federal government won't do this, we at a state level must hold AHPRA to account, because we are here to serve the people, and they are not being served by a body which is, in general, very, very good, but has major problems, and problems which have caused death and destruction to our people. And we, as representatives of the people, it is incumbent upon us to make sure that the right questions are asked of the right people at the right time and hold to account those who currently are not accountable to anyone, not here, not in Canberra. There's a state and a federal problem, and I do ask that you listen to what I've said. Now, I know full well this is not going to come across. No one's going to pay attention. This bill will pass, absolutely. I will protest it on behalf of my colleagues, on behalf of the healthcare practitioners. I will stand here and say this bill should not pass. Not because the bill itself is bad. It's an excellent bill for what it is, but because we have failed to put in there the right framework to hold a body to account, and that needs to be held accountable and is not being held to account. So we have failed in this. We must rectify this. So whatever happens with this bill, I hope, I pray, that the responsible ministers will take this to account and will take this to the appropriate level, such that somewhere, sometime, someone's going to get some common sense and put in place the provisions to hold an august body like AHPRA formally to account.